Welcome to the News OK Studios. I am Adam Kemp, General Education Reporter here at the Oklahoman. I'm joined today by Dr. Kayse Shrum for the Center for Wellness and Recovery Center at OSU Health Sciences. Dr. Shrum, how are you today?
Very good.
Awesome. Hey, we are joined by you today to discuss the recent settlement with Purdue Pharma and how that will affect OSU Center for Wellness and Recovery. $270 million was the settlement, $200 million of which is kind of headed your way.
Yes.
I wanted to just get your quick reaction to what was that like when you first heard that news?
Well, overwhelming emotions, very excited that something that, we put into place at the OSU Center for Health Sciences because there was such a need in our state would receive that kind of funding is phenomenal for the state, and the amount of work that we can do with that amount of money is going to have a huge impact.
Well, thank you. The mission of the Oklahoma State Center, or Oklahoma State University Center for Wellness and Recovery, is to save lives and to rescue those who are struggling from addiction. This endowment will allow us to assist communities in Oklahoma and across the nation ravaged by the opioid epidemic with innovative.
Can you kind of detail what is the need for, the study of, addiction and opioid abuse here in Oklahoma? Why is it important?
Well, first of all, as I talked about, we began looking at that in 2013 and recognizing we needed to put addiction medicine into our coursework for the medical students because of, we recognize that in medical school you don't get that much on addiction. And so it was very important to put that into our curriculum. And out of that, we began to recognize that there are a great many number of people in Oklahoma who were suffering from addiction and really underserved. And taking care of the underserved and rural population is our mission at OSU. But recognizing those that are addicted as underserved was key, because there's a stigma about it, and many people don't recognize it as an actual medical disease. It is a brain disease, and we need to do more research in that area to understand it and to get rid of the stigma so people can, get care. And doing research so we understand how do we prevent it, how do we treat it in an effective manner is very key. And so I think the need is just tremendous there, and the barriers are great because there's not a lot of funding going towards that, and there's not a lot of access for individuals and families who are suffering.
More than $100 million right off the bat. Can you kind of detail how this will immediately affect you?
Yeah, so as a part of the settlement, we are first and foremost going to be setting up a 501c3 that will be the foundation for this money. And with that, setting up a national scientific advisory board, which is going to be, I think, key for Oklahomans and for the United States. As I've said before, here in Oklahoma, we've been recognized for our poor health outcomes. Our health rankings many times are at, the very bottom. This is an opportunity for us to be recognized as a leader in solving a problem and a very serious public health crisis. And so it is something that bringing in those national experts, putting together that panel, recognizing what research needs to be done, those are all the first steps in putting this center together and utilizing the money to to amplify the efforts that we have going currently.
Can you take us back for a minute? The center was opened in 2017.
Yes.
The fight for funding and the fight to, look for grants and then things like that. How much of that has been a part of your role, and how much of that will kind of be relinquished a bit, I guess, now that you have this funding and you can focus on other things?
Yeah, so starting out in 2017, as I said, we had done a lot of work going up to that point in time and hiring physicians who have addiction medicine certification, researchers, and bringing those folks together at a point in time, if you remember back in 2017, when at the Bedlam game there was an effort to recognize stopping the epidemic and the crisis. And so it was at that time that we announced the Center for Wellness and Recovery. And so from that perspective, really just starting to build around what we had already been doing and putting that formally together and creating a center allowed us to start going out and actually raising money and getting those researchers as a core together to be competitive for national grants. And we have been able to get grants with the CDC. We've partnered with the Oklahoma Department of Mental Health and Substance Abuse on their grants. We have received grant funding from NIH. The Zero Foundation gave us a gift of space for the Center for Wellness and Recovery at the amount of $10 million. Wow. So we really have had support. This will allow us to expand and I think attract another level of researchers and bring in those national experts to help drive what we do. I don't think we'll stop raising money around it. That's a significant amount of money, but there's a significant amount of work to be done.
Sure.
And so I do think this gives us a stronger foundation to be able to go out and say, look, we have this endowment, we need to do more and continue to raise money around that so we can serve as many Oklahomans and put as much research and best practices around the treatment of addiction into the practice of medicine that we possibly can here in the United States.
Where have you seen the center already, having an impact in people's lives?
Yes. Well, first and foremost, I think our greatest impact are those lives that we change because they actually have access to treatment. Many times just in my personal life, I've had individuals reach out to me and say, I'm really embarrassed about this, but I had knee surgery and I can't get off my pain pills and I try but I can't and I don't know what to do and it's affecting my life. We see daily people come in and get treatment and are able to go back to the lives that they had previously, and so that's very rewarding. We've also been able to go out into rural communities, and we'll see that rolling out over the next year. We received a grant that will allow us to go out to 4 different rural communities across the state and provide treatment and education within those communities, because what we want to do is build capacity in those communities across the state so that everyone can get access. It's always about getting the right care at the right time in the right place. And so while we're located in Tulsa, we're very much aware that the need is great and across the state. And so we've had an impact through that. We also utilize a program called Project Echo that is a way that we can train primary care physicians or provide them with the information and the knowledge through a technology platform to push our expertise out to the front lines so that they can become experts and manage those patients in their communities in a trusting environment, because many people have strong relationship and a trusting relationship with their primary care physicians, right, that they may feel comfortable going and saying, hey, I have this problem and I need help. We want those doctors to be able to say, I know how to help you.
Okay. This money could have been split into so many different ways and gone so many different avenues. What does it mean to you that the bulk of it is going to the center?
Yeah. Well, I think it is an acknowledgement of the fact that we've been doing good work and that we're addressing the needs of the state and we're being aware that we have a moral obligation as an academic health center to address the needs of the citizens of Oklahoma, and that we've been recognized for doing a quality job of that. And you know, I'm very proud of the individuals that at OSU that have taken this on. They've done very strong work, and very proud that they're being recognized and that we're being entrusted with this money, and that we will be good stewards of this money to serve the state.
Sure. Kind of the last thing I had, Purdue Pharma, known for being the makers of, you know, OxyContin, a really addictive opioid that has kind of ravaged the nation. To get the money, having it come from that company and knowing, you know, its source, does it feel a little bit like a little bit of justice there?
I think so. I hope that it does provide some comfort to individuals who have, you know, suffered at the hands of the pharmaceutical company, knowing that those lives and that suffering hasn't gone in vain, and that good will come from it in the future through this Center of Wellness and Recovery.
Sure. Dr. Kayse Shrum, I'm Adam Kemp. Thank you for joining us today. For more coverage on this story and more, visit us at newsok.com and every day in the Oklahoman.